When we are talking about drugs of abuse, we want to also think about intoxication. How does someone present with an overdose of these drugs? We also want to talk about how can we pharmacologically treat intoxication, how can we help with withdrawal, how can we treat substance abuse, substance use disorder. So if you're looking at these drugs, you're probably going to realize, well, they present differently in terms of how a patient would show with an intoxication of these drugs. And hopefully you figure out, well, opioids, alcohol, benzos, we could put them under the umbrella term depressants, because, well, how would somebody present with? Rather kind of passing out on somebody's couch, compared to cocaine and stimulants, somebody running manic. So these are more considered stimulants compared to those drugs which you would put under the umbrella term depressants. Now, if you're thinking about intoxication, again, we're going to separate the depressants from the stimulants because they present very differently. But within the depressants, I want to now group pharmacologically alcohol, barbiturates, and benzos, because they all act at the GABA A receptor. So that's their target, A for alcohol. This is a GABA A receptor. GABA is this major inhibitory neurotransmitter. In contrast, the opioids act at a different receptor. That's this mu receptor, kappa and delta, the opioid receptor. Now, why is that important? Because alcohol, barbiturates, and benzos present very similarly. Well, how do you feel when you drank alcohol? Sedated, so sedation. Anxiolysis, so you're not going to be afraid of anything. Disinhibition, so you may say stuff that you regret thereafter, that you rather would have wished not to say, so you are disinhibited. Now, opioids have one very characteristic sign in overdose that everybody has to know. This are the pinpoint pupils. So let's draw in here an eye. That's super characteristic, the pinpoint pupil. What are people dying of in overdose? And that's similar to all of the depressants. So we can make here a line over all of the depressants. What are gonna people die of? It is respiratory depression. So that's what the people are gonna die of. This is the reason for our GABA drugs as well as the opioids. That's why they're super dangerous. Now, let's finish up with our stimulants. That's fairly straightforward. How do you feel when you have taken a stimulant too much? Also, well, agitation, arousal, you're awake, fight and flight, right? Because what are these doing in terms of neurotransmitters? Increasing norepinephrine. So our heart rate is gonna go up. Our blood pressure is gonna go up. We may have psychosis because many of them also increase dopamine. And that's the reason why we feel good, euphoric, and they are addictive.